Can you quickly review and discuss what's the agent doing? What's happening on the screen?
The agent is currently analyzing 10 EEG files, trying to identify patterns that might suggest a diagnosis from a neurological perspective. It's focusing on detecting muscle artifacts and patterns related to bruxism, while acknowledging the limitations of making a full diagnosis based on static images.
Okay, what else is it doing?
It's refining its analysis by looking at the frequency and spatial distribution of muscle artifacts, correlating them with the user's clues about bruxism. It's also noting the absence of patterns indicative of night terror events. The agent is carefully constructing its response, integrating all observations, and emphasizing the limitations of the data.
Okay, I keep scrolling down on their response. What else are they trying to do?
It's organizing its findings into a clear structure, focusing on presenting a detailed assessment of muscle artifacts and their correlation with suspected bruxism. It's also ensuring the report includes a disclaimer and maintains an educational tone, emphasizing the limitations of using static images for diagnosis.
Okay, what's their response is?
The agent's response is providing a detailed analysis of the EEG snippets, highlighting rhythmic muscle artifacts consistent with sleep bruxism. It describes the morphology and location of these artifacts, while also explaining the limitations of the data and the need for further clinical information for a complete diagnosis.
Okay, keep going.
It's further elaborating on the findings, detailing the specific timeframes where the muscle artifacts are observed, and explaining their characteristics. The agent is also reiterating the need for more comprehensive data, like the complete EEG data and clinical information, to make a definitive diagnosis.
But we did provide the complete EEG data. What else are they saying?
The agent is acknowledging the presence of rhythmic muscle artifacts, which are characteristic of sleep bruxism. It's also mentioning the associated features, like the disruption of the background EEG rhythm and tachycardia, suggesting a brief arousal from sleep. The agent is emphasizing that these findings are consistent with sleep bruxism, but still require further clinical correlation.
Okay, what else are they saying?
The agent is also discussing the background EEG rhythm and sleep staging, noting that the activity appears consistent with lighter stages of sleep, rather than deep sleep. It also mentions that the images labeled night terror EEG show a mixed frequency EEG, but not the classic pattern typically associated with night terrors. The agent is evaluating other potential diagnoses, like epilepsy and night terrors. It notes that there are no clear epileptiform discharges to suggest epilepsy, and the EEG pattern doesn't match the typical night terror pattern, which typically arises from deep sleep. The agent in conclusion that the primary findings are most indicative of sleep bruxism. The agent is providing an impression and potential diagnosis, suggesting that the findings are highly suggestive of frequent and significant sleep bruxism, associated with multiple arousals from sleep. It also mentions potential consequences of sleep bruxism, such as jaw pain, dental damage, and fragmented sleep. Finally, it recommends a full polysomnogram review and ruling out other sleep disorders to confirm the diagnosis. No, the agent is not suggesting epilepsy. It note specifically mentions that there are no clear epileptiform discharges that would suggest an epileptic seizure. The primary findings are more consistent with sleep bruxism. The agent is recommending a full polysomnogram review to confirm the diagnosis and rule out other sleep disorders, such as obstructive sleep apnea, which can cause arousals. It's also suggesting that a thorough clinical history and dental examination would be valuable for accurate diagnosis and treatment planning. Based on the provided images, The agent's impression is that the findings are highly suggestive of frequent and significant sleep bruxism, associated with multiple arousals from sleep. However, it emphasizes that a formal diagnosis requires a comprehensive evaluation, including a full polysomnogram and clinical correlation.
So are they sure it's not epilepsy?
Yes, based on the EEG snippets provided, the agent's assessment is that there is no clear evidence of epilepsy. The findings are primarily indicative of sleep bruxism. Yes, I'm sure. The agent's analysis clearly states that there are no clear epileptiform discharges that would suggest an epileptic seizure. The observed patterns are consistent with sleep bruxism, rather than epilepsy. The agent is re-evaluating your question, reinforcing its initial assessment that the findings are more suggestive of sleep bruxism than epilepsy. It's further explaining the specific characteristics of the EEG patterns, like the spiky morphology and location over the jaw muscles, that strongly indicate muscle artifact associated with bruxism. The agent is further clarifying its diagnosis, emphasizing the distinction between muscle artifact and epileptic activity. It's preparing to provide a more detailed explanation, likely including a comparison table to highlight the differences in morphology, location, and clinical context. The agent is providing a detailed comparison between the observed patterns and typical epileptic seizure activity. It's highlighting the differences in the source, appearance, and location of the electrical activity, explaining why the observed patterns are indicative of muscle artifact from bruxism, rather than epilepsy. Certainly. The agent notes that the observed patterns originate from muscles outside the skull, specifically the jaw muscles, whereas epileptic seizures originate from brain neurons. The observed patterns have a high frequency, spiky appearance, and are localized directly over the jaw muscles, unlike the evolving patterns seen in epileptic seizures. Additionally, the observed activity stops abruptly when the muscle clenching stops, whereas a true seizure is typically followed by a period of post-ictal slowing, which was not observed. The agent is using an analogy to further explain the difference. It compares the muscle artifact to the sound of an engine heard from outside a car, while comparing an epileptic seizure to a person shouting from inside the car. This analogy highlights that the observed activity is originating from external sources, the muscles, not from the brain itself. The agent is examining a new image and trying to determine if it contains the same data as the previous images. It's noting visual differences in color, annotations, and montage, and is looking for ways to compare the underlying EEG signals despite these visual discrepancies. The image appears to show EEG waveforms, similar to the previous images, and the agent is trying to determine if the underlying data represents the same events or different ones. The agent has concluded that the new image contains different EEG data than the previous images. It notes differences in color, channel counts, annotations, and the presence of different types of artifacts, such as eye flutter and 60 Hz interference in the new image. Therefore, it determines that the data is not the same, and likely comes from a different source, such as a textbook or scientific paper. While it's possible to have different montages of the same data, the agent's analysis indicates significant differences beyond just the arrangement of channels. The differences in color, annotations, and the presence of distinct artifacts suggest that this is a completely different EEG recording, not just a different presentation of the same data. Sure. How about asking, do these new EEG images represent the same data as the previous ones, or are they from a different recording? Based on the agent's analysis, it's unlikely that the new image represents the same data with a different montage. The agent identified significant differences. Okay, here's a question. Could the variations in artifacts, color, and annotations between these EEG images be accounted for by a different montage of the same data? Or do they indicate a completely different recording? The agent is carefully considering your question about the possibility of a different montage. It's examining the nature of montages and how they affect the appearance of EEG signals, particularly in relation to identifying artifacts. The agent is working to clarify how montages can alter the visualization without altering the underlying data, and how to distinguish between different signal sources, like bruxism and electrical interference. The agent is explaining that the key difference lies in the types of artifacts present. It clarifies that montages only change how the data is displayed, not the underlying signals themselves. Since the two recordings show distinct types of artifacts, like bruxism and 60 Hz interference, it indicates that they originate from completely different events and sources, regardless of the montage used.